Hey guys, Cody Straight here from Access eForms, and not too long ago, we provided a webinar series that was all about patient eSignature and the strategy behind that. And we did this with a couple of our current customers that have used eSignature and expanded from registration to the clinical care setting, okay? And we'll provide links to that webinar down below as links to other resources. But look, what this video is all about is now that some of you might have seen that webinar series and you might be thinking, how do I bring eSignature in the clinical care setting to my hospital? How do I bring eSignature in the registration setting to my hospital? How do I make it a reality? How do I build that business case, right? So in a previous video and in a previous blog post, we started to talk about how you build a business case for eSignature and registration. That's not what this one's about. This one is all about how you build a business case for eSignature in the clinical care setting, right? In registration, look, it's all about eliminating paper. So on average, every patient that walks through your doors will sign about 5 different pieces of paper. So you can do the math on that. That's a ton of paper, that's a ton of sticky labels, there's hard cost associated with that. The paper volume typically in the clinical care setting, it's different, it's less, okay? So the way that you want to approach a business case to justify an eSignature solution in the clinical care setting, it's not really about eliminating paper. Yes, that is a part of it. That certainly is an aspect, but what it's really about, it's about eliminating lost forms. So make sure that you understand that. In the clinical care setting, you justify an eSignature project because you are able to eliminate lost forms. So let's look at this in the context of surgical services, and let's look at some of these numbers here, and you can see very easily how there is a plain, clear, common sense business case that any of your executives will appreciate, okay? So here's a few numbers here, and again, we'll put links to these statistics down below. 14% of operative procedures on average are delayed because of missing paper consents. So 14% of procedures are delayed because of missing paper consents. Number 2, 22 minutes is the average length of time as a result of that delay. So each delay on average is 22 minutes, okay? 14% of procedures are delayed, average of 22 minutes. And here's the third number here. The average cost for a lost minute in the OR on the lowest end is $60 per minute. And the range is typically from $60 up to $120 or up to $150 per minute, depending upon the complexity of the procedure, okay? So if you look at this and you look at those numbers, and obviously if you know your own numbers, if you know that, hey, 14% is not my number as far as the number of procedures delayed because of paper, then use your own numbers. If it's 8%, fine. If it's 18%, use that. If you know your own numbers for the average delay, that it's not 22 minutes, it's 8 minutes, oh, great, whatever, use that. But these are numbers that come from different research studies out there, okay? So you can see that these numbers really add up. And guys, your OR is your hospital's greatest revenue producer, but it's also the greatest cost center as well, okay? So it makes the most, but it sure as heck costs the most as well. So if you go to your executives and you say, hey, I can eliminate 25,000, 35,000, 55,000 pieces of paper a year by going paperless in the clinical care area, they say, oh, okay, that's something. But if you approach them and you say, look, I think I've got something here that can improve our OR on-time starts by 14%, there's something to that, all right? So that's how you want to think about this. That's how you want to frame this, and that's how you want to justify this. And guys, there's all sorts of areas that you can carry this further, right? So for example, whenever you have a delay in one procedure, is that delay exclusive just to that one procedure, or can that delay cascade over into other procedures, creating all these other delayed procedures that could result in canceled surgeries, that can result in nursing overtime? I mean, there's all these different ways that you can take this, right, guys? But there's just the tip of the iceberg as to how you really need to frame your thinking towards forming a business case for eSignature in the clinical care setting. And look, we are here to help you not just with the technology, not just do demos and things like that. We're helping you to build out your own business case. So if we can help you justify your business case, because we've done this with other hospitals before, we're happy to do that. Let us know. We're here to help. But guys, thank you so much for watching this video. Thank you so much for tuning in. If we can help out with anything whatsoever, just let us know. Thank you.